Should I participate in cardiac rehab?
Well, that's a really good question, Sherry. We're looking at research on cardiac rehab participation, and there was a really beautiful study that was done and published in 2021. And they studied women with SCAD and FMD and recommended cardiac rehab, moderate intensity exercise, interval training, as well as light weight training. And they were specific to say not contact sports, not yoga with, any strain on the neck for that particular population. So there hasn't been a lot of research on cardiac rehab and SCAD patients, but the research that has been done has shown that it's beneficial in terms of managing stress, reducing distress, and also improving exercise capacity.
So, how might cardiac rehab help me to understand and manage any new limitations that I might have?
Yeah, so cardiac rehab, I think, is there to be supportive, to help you to gain confidence, to help you to know what your limitations are. And especially for SCAD patients in that first 3 months, that's a time of healing. So it's really important to have sort of a little bit of limitation on what you're doing at that point. It's also really beneficial for people to access services. It's not just about your physical health, it's also about your mental health. So, we have stress management, we have vocational counseling, we have psychology, you can see the physician, you can see the dietitian if that's needed. So there's a lot of different resources that people can access.
When I did have the opportunity to go into cardiac rehab, I found it extremely helpful to go in quickly and have the time with you, get to see what I needed to do in a safe environment. I was scared to do almost anything right after my SCAD. So knowing I was safe and how much I could actually do definitely helped me, and it made me feel more secure, and I know that it definitely helped my recovery.
Good, I'm so glad.